It was 5 years ago this week that COVID-19 was declared a global pandemic by the World Health Organization. The deadly virus and the resulting lockdowns, of course, had a major impact on everyone around the world. Jessica Clement spoke with Dr. Janet DeMille today, the district's medical officer of health, about those early days of the pandemic and the lessons that were learned.
We saw that all of that happening. We knew that it was going to get here really eventually. And so there was a lot of, concerns, getting prepared, but there was also a lot of uncertainty at that time.
By the time COVID-19 was officially declared a global pandemic on March 11th, 2020, Dr. Janet DeMille and her staff at the District Health Unit were already anticipating it to affect the region.
I remember actually it was Bill Morrow, who was mayor at that time, dropped by here in the early days of what was happening and just connecting with him, right? Connecting with the city, making sure we were, establishing or building on those relationships so that we could have that effective communication. It was also about healthcare providers, so talking to the hospital.
In the 5 years since the declaration, the health unit and other agencies administered hundreds of thousands of COVID tests and almost 500,000 vaccines. The Thunder Bay District saw thousands of positive cases and 172 deaths with COVID-19 as the underlying cause. DeMille says there were a lot of lessons learned, not just locally but globally, that can help us prepare for possible future pandemics. That includes the importance of personal protective equipment, mass immunization clinics, and getting a vaccine out quickly. However, she notes that there were still a few things that needed to be taken more seriously, like clean indoor air.
Proper ventilation and filters and things like that, and I feel like that would help us in the next, another pandemic. Not sure that's a lesson that's been really implemented at this time. I think one of the areas that are probably the biggest concern is with respect to another pandemic, for example, is healthcare capacity and public health capacity.
And while the day-to-day effects of the pandemic are behind us, DeMille notes it's important to remember that the virus isn't gone.
There's a certain unpredictability of it, but the variants that we see, for the most part, are causing milder illness. However, there are still people hospitalized pretty much all the time due to COVID.
Jessica Clement, TVT News.